this is Amber from Soul Revival Podiatry, and today we're going to be talking all things fungal infections. Not a subject that most people want to talk about or think about, but they're probably the most common pathology that podiatrists will see in their clinics. So, fungal infections. Let's have a think about what they look like on the skin first of all. Typically, when they start, they'll start between the web space of the two little toes, so the fourth and the fifth toe. It might start out with an itch that bothers you, particularly when your foot is hot. What you might see is a little bit of dampness or redness or white patches. You might have scaling on your skin or small blisters called papules that form in patches. And once the skin infection becomes chronic, it might mimic where a shoe would fit on the foot. And typically those are infections that have been around for quite some time. And by that point, people might not be aware that they've got them and they may not be itchy. And the fungal infection on the nail, the first time most people will see it is when they take nail varnish off, and then they'll see a white flowering patch on their nail that wasn't there before. But that's the start of a superficial fungal infection on the nail. It might start off underneath the nail, or when your nails are wet, you can see that they're changing in colour. They might look yellow or brown. It might be the top of the nail, one side of the nail, or a streak down the nail. It will spread to other nails, and all the other nails will change and take on that yellowy brown hue. Whilst it won't harm you, it will change the quality of your nails, so you'll end up with thickened nails that don't look very nice. Early treatment is best for all fungal infections, and they're easy to treat actually, particularly in the early stages. Superficial fungal infection on the nail can be removed during a medical pedicure, and also any diagnosis can happen then, and any further treatment can be given to you. In order to stop it coming back, you also need to remove the fungal infection from your environment. So that means cleaning the insides of your shoes with an antifungal spray, doing a hot wash of bath towels, bath mats, bedding, socks, tights, anything that comes into close contact with your skin and your nails of your feet. Checking other people that you share spaces with to see whether they've got an infection they're passing to you or you're passing an infection to them. And then finally to do a disinfectant of all hard surfaces where you're barefoot at home. So a podiatrist will pick up any fungal infections and treat it and recommend home treatments potentially as well. But the key thing about fungal infections is the earlier the better. As soon as you see some symptoms, treat it.